My name's Joe Dort. I am an academic head and neck surgeon and clinical researcher. I work at Calgary, Alberta, Canada. In addition to the clinical work that I've been involved in, which is taking cancers out of the ear, nose, and throat, neck area, I've also been heavily involved in creating and leading a clinical effectiveness research program, to call it. That's what I'll call it. So we basically look for relationships between tumor tissue, clinical outcomes, cancer outcomes, and my personal passion is designing and delivering better approaches to healthcare, to how you'd. And so our healthcare system is in some ways similar to what goes on in the UK, in that it's publicly funded and universally accessible, but we have our challenges in terms of bringing about meaningful change to that system because it's so embedded in our culture. And so anytime, and it's very political as well. So the work I've been doing around design and delivery has been, it involves a lot of planning, mapping, getting groups together and helping them to visualize what's going on. And so that's where my interest and inspiration, and also when you're sitting down with a group of people to plan out a research project, a lot of moving parts, and sometimes it's easy to get lost, lose track. And so using inspiration to help map things out from a research perspective, it's so quick to be able to do it with that rapid fire feature. That we have a number of new projects going on, and I'm doing some mapping of coding manuals and data dictionaries, and I find that inspiration is not a bad way to organize that, because you can embed your notes and text and all the rest of that. And, oh my, it could be 20 years ago, possibly even longer. I at the time here in this province, it's provincial healthcare. So here in this province, we were creating an integrated program for hips and knee surgery. So hip and knee surgery, just like in your country, is very common, and there are huge backlogs, and it was very fragmented. Different cities, different surgeons even had different approaches to it. So this a donor came along, and I'm not an orthopedic surgeon, but at the time I was very involved in clinical process improvement, and so I got involved in the design of this. And one of my colleagues was a PhD, I guess you'd call him an organizational psychologist, PhD psychologist. And he used inspiration. He's the one who introduced me to the tool. And literally we'd be in a room with dozens of people from surgery, from nursing, from administration, and all these ideas would be flying around. And ultimately he'd come up with something that was organized, and then he put it up at the next meeting. He would have printed it out on big posters, if you will, that went all the way around the room, and people could just walk along and follow the different processes, and with their markers write in what was working or what was right and what was wrong. And so it's an iterative process, but the tool, and embedded within each of these boxes, was the text that described when it was needed. And so ultimately that's how our provincial bone and joint program, and this guy, Doug Smith, introduced me to it. And I thought, well, Jesus, I've been missing the boat here. And I started to use it in my own research when I started to redesign how we manage head and neck surgery, head and neck cancer surgery. And we put together a pathway that we started using in 2010. It took a couple of years to design it, but same process. And bringing these posters over to the hospital, the nurses would look at it and they would mark it up, and I'd take it back and revise it. And it proved to be very useful because people can follow it.